Okay.
Well, folks, I guess I can get started on introductions. I'm Mary Sue Lanigan. I'm with Michigan Parkinson Foundation. This is the 4th session in our Living with Parkinson series. Today's program is on the role of physical therapy and occupational therapy in managing Parkinson's disease. We have one of our favorite and best speakers, Angee Ludwa, who teaches our exercise classes on Tuesday morning, who's actually responsible for getting our exercise classes started. So Angee, as many of you already know, is a physical therapist with Ascension Health in Michigan, specifically at Genesis in Grand Blanc. And she is joined today by Allison Ryan, who she works with, who is an occupational therapist. Also at Genesis Ascension. She's a certified brain injury specialist, and she is certified in LSVT Big and Power Moves. So together they are going to talk about the role of physical therapy and occupational therapy in managing Parkinson's. Now I'm going to, it looks like Kelly, my coworker's on. She's already muted everybody. So just Angee and Allison, unmute yourself, and then Angee, you're going to share the slides, correct?
Correct. Yep.
Okay.
Can you hear me, Mary Sue?
Pardon me?
Can you hear me?
Yeah. Can everybody, if you can hear Angee, go like this. Thumbs up.
Okay, great. All right.
Okay.
I'm going to share the slide and then make it big. Okay. Can everyone see that?
Mm-hmm.
All right.
Yeah, it's perfect.
Perfect. Okay. Well, welcome everyone. Thanks for joining us. I know it's hard right after lunch, so it's probably like your nap time. So we'll try to keep it somewhat interesting so you don't fall asleep on us. We'll have questions after Allison talks. So I'm going to just get started with a little introduction here. Not going to spend a lot of time on this because as many of you are very familiar with Parkinson's, right? So as you probably all know, Parkinson's is a brain disorder that's associated with a loss of dopamine producing cells in the basal ganglia. So just to make a note here, it's the nerve cells that produce the dopamine that die. And so what we want to do through exercise and therapy is protect those nerve cells that you have left. So if you've heard the term neuroprotective, and that's out there a lot in the research, we're trying to protect those nerve cells that you have remaining that produce that dopamine. So that's really important. Something else to note about Parkinson's, it's a chronic and a progressive disease, just in the sense that, yeah, it's progressive, but through exercise, medication, and nutrition, it can be managed over a long time. So in that way, considered more of a chronic condition. Obviously, there's motor, non-motor symptoms, and it affects about 1 million to 1.5 million Americans in the United States. Okay, just a quick schematic here, just to show you, I don't know if you can see my area. The area that produces the dopamine is deep within the midbrain, basal ganglia area right in there. Just to give you a picture of that. And so obviously we talked about there's motor symptoms, non-motor symptoms. Now, as far as the motor symptoms go, not everyone presents with all these symptoms. As you all know, some people have tremors, some people don't. But the major motor symptoms are slowness of movement, stiffness, balance problems, tremors. Some people have tremors. Soft voice, your voice may get soft, problems with fine motor, problems with writing, and then maybe some walking problems and postural problems. So again, non-motor symptoms, which some of you may be familiar with, listed here. Now, the REM sleep one, that's kind of a big one. And so I think if any of you are having symptoms with that, definitely talk to your doctor about that. That's one of the first signs that many people have before they're even diagnosed with Parkinson's. They'll start to have sleep issues. So there's things that can be done. So definitely talk with your doctor about that. And this is a big one, the emotional symptoms in Parkinson's. And I think sometimes we don't really pay attention to this, but there's this apathy, like loss of motivation, depression. So just, kind of be aware of that. And then anxiety. And so these are all the emotional symptoms it's not just you, it's what happens when you have Parkinson's, when there's loss of dopamine, but also other neurotransmitters, you can get these symptoms. And it's hard to detect. So listen to your significant others, because maybe they're sensing something that you're not. All right. Treatment options, obviously medication, deep brain stimulation. And of course, we're here to talk about occupational therapy, physical therapy, exercise in general is helpful, and then nutrition. But we're going to focus on occupational therapy and physical therapy. So with that being said, I'll let Allison take over and talk about occupational therapy.
Thank you. And Angee, are you controlling my slides?
I am. So just let me know when you want to forward it.
Sounds good. So as Angee was saying, occupational therapy is one of the therapies that can help. It's a treatment intervention for not only people who have Parkinson's, but anyone who is recovering from any injury or that's coping with a progressive disease. So OTs help people across the lifespan participate in the things they want to do and that they need to do through the therapeutic use of everyday activities, which are occupations. So we all have occupations. When people hear occupation, they think of work, what do you do for your career? But in the therapy side of things, occupations are all of these activities that make up your day. So OTs can help toddlers learn how to play and how to develop, and they can help the older adult with their occupations, whatever that may be, whether it be driving, showering, all those things that make up our day. And we generally don't think about our occupations. We take them for granted. We take for granted being able to put on our socks and put on our shoes and just do things out of habit that we've done our whole life. Handwriting is another prime example. So if you're recovering from an injury or you have a disease or condition that it's difficult to engage in everyday life, these valued occupations may be disrupted, and OT can incorporate those occupations and give you specific exercises to help you engage in them at the best possible way. So we can go to the next slide here. So a lot of people wonder, like, why would I need OT? What are the signs that I would need a prescription from my doctor to go see an occupational therapist? So with Parkinson's, if you're noticing that you are having frequent falls, if you are noticing a change in how you're able to do everyday activities, if you're requiring more assistance, if doing simple things like dressing and showering, if that's making you more tired throughout the day, or you feel like your movements are really slow when you do those activities, it might be a good time to go see an occupational therapist. If you're noticing changes in your memory, if you're feeling more uncoordinated, not only with walking, but handwriting, those fine motor movements are so important, buttoning, zippers. If you're noticing any change in your vision, that can contribute to falls, but an OT could help with those visual changes too. And again, if you're noticing any change in your overall activity tolerance, if you're feeling weaker throughout the day, it might be a good idea to come and get some OT. So your first appointment will be your evaluation. So you'll go through an occupational therapy evaluation. And this is where you'll be, hopefully your spouse or a family member can be present with you during the evaluation. I know right now with the coronavirus, some of that is tricky, but hopefully you can have a loved one there because they have a lot to contribute as well. So we'll go over just a medical history review, what symptoms you're having of Parkinson's disease, what were your initial symptoms when you were diagnosed, what symptoms are you having right now that are really bothering you, and how are those symptoms impacting your ability to complete tasks throughout your day. So how is, for example, a tremor affecting your ability to get dressed, to shower, get on and off of the toilet? How is your balance impacting that? Driving is a large area that we take for granted. So how are you driving right now? Your memory and meal preparation. If you're in charge of making the meals for your family, are you able to, attend to the task and multitask without having any trouble? And we'll also go over a fall history. So how frequently are you falling? Are you able to get up if you do fall? We'll go through your strength of your upper body. as well as coordination. Again, we'll look at vision and your memory and endurance throughout everyday life tasks. OTs and PTs, there will be some overlap, but we can also work on bed mobility. That's a big challenge, rolling in bed and being able to sit unsupported on your bed and get up to a standing position. That's always something we take for granted too.
Right.
And treatment. So this is the fun part, right? Depending on what your script reads from your doctor and depending on what program you're doing, the treatment can vary. So it's custom to you, which is what's so great about therapy. So generally it'll be 2 to 3 times a week, anywhere from 4 to 12 weeks, again, depending on what your physician and your therapist recommend. And each treatment is unique and custom to you. And your therapist just wants you to meet whatever goals you have, and they'll go over that again in the evaluation. If you're concerned about dressing, if you want to work on balance, all those things will be custom to you, and you'll engage in a therapy that will help you meet those goals. Some treatment can incorporate power moves and LSVT big moves, which are another evidence-based approach to Parkinson's disease. So just specific exercises to help slow the progression of the disease. And all treatment interventions, whether you're going through the power moves or LSVT big, they will be evidence-based to just help you reach that highest level of independence possible.
Okay.
And so OT, just overall, whether you've been living with Parkinson's disease for a month or 5 years, or even if it's been 20 years, an OT can help you meet your goals and live life to the fullest. And your goals will change as you age and as the disease progresses. You'll work on different goals each round of therapy. So just because you've had OT and PT one time, it doesn't mean you should only go one time. You can come back for tune-ups and continue to work on new goals, no matter where you're at. And some OT and PT, they're designed to just maintain what you have, to keep you strong. So there's a lot of options for therapy, and it's always custom to you, which is very important.
Great. Okay, thanks, Allison.
Yeah.
So Allison and I work together, which is great. So we have a good relationship. So a lot of times there's overlap, which is good because we can talk to each other and say, hey, how are they doing with that? How are they doing with this? But in general, what is physical therapy? As I mentioned, there's overlap, but we provide education and expertise to help people function more effectively. That's just like a broad general term. Some of the questions I get about therapy is, does it require a prescription from your doctor? Yes, it does if you want your insurance to pay for it. So if you're interested in getting physical therapy, definitely get a prescription, and it can be from your primary care physician or your neurologist. It doesn't have to be just your movement disorder specialist. And again, check with your insurance, because I would say most insurance does pay for physical therapy, and always say, take advantage of your insurance, because I usually recommend people go to therapy minimum once a year, minimum. And then the other thing is, if it's possible, do some research to find a that specializes in Parkinson's disease, which can be challenging, but there are some websites, the LSVT Big website and the Power website can help you find some therapists that specialize in Parkinson's. Or feel free to give me a call, and Allison and I can help hopefully find you a therapist in your area that specializes in Parkinson's. Okay, so what does a physical therapy assessment look like? As Allison mentioned, we try to do a thorough medical history. We really look at like your motor, non-motor symptoms and how those are affecting your movement and your medication, because your medication is important as well. What medication are you on? Are you having on or off times? Because that's going to also affect your movement. So there's a lot of things we ask. So the first day is a lot of questions, so be prepared. And then again, as Allison mentioned, we look at your coordination, your strength, your balance, your walking, your ability to perform maybe dual tasks, multitasking activities. That can be challenging. One thing I'll mention too about the assessment is we do standard outcome measures. so that once we have your baseline, we keep those measures. So when I say come back every 6 months, when you come back to that same therapist, we can redo those measures to see where you're at. Are you the same, which is good? Are you better? Are you declining a bit? So that means we got to come back to therapy or pick it up a bit. So if you've never had a physical therapy assessment, I'm going to recommend everyone here to get a prescription and go to your physical therapist just to get those baseline assessments done. So then again, what does treatment look like? So this is really flexible. It can be 1 day a week, 2 days, 3 days. The LSVT big protocol is 4 days a week for 4 weeks. So it kind of depends on maybe what your schedule is like, how much you can tolerate, and what your needs are. Now, when we do the assessment, that's a good time to say, okay, I think you're going to need 2 times a week, 3 times a week, or maybe you just need once a week. So that's why it's always good to get that assessment in. And during the treatment session, it shouldn't be a piece of cake. So it should be what I like to say, difficult, but doable, because you want to make sure that what you're doing is making a change. So it should be a little bit difficult. So it's not going to be easy breezy. And some of you that have been to physical therapy probably know this already. And again, as Allison mentioned, we try to do evidence-based, and I shouldn't say try, we definitely do evidence-based treatment. So that could be power moves, LSVT big, or any type of other balance exercises that, you know, prove to help people with Parkinson's move better. Okay, so just a little bit here about some of the specific treatment options. And many of you may know the Parkinson's Wellness Recovery Project, which was started by Dr. Becky Farley. So the nice thing about this is it's a very flexible program. So you can go 1 or 2 days a week. You can do the exercises with the physical therapist, occupational therapist. You can do them in the community. So the whole goal of this program is to have this continuum of care. So if you go see a physical therapist, you learn these moves, you're done with therapy, you're not just, hey, good luck, see you later, because that can be challenging. You transition to a community-based exercise program, such as the Michigan Parkinson's Foundation programs. You do those for a while. If you feel like, as Alice mentioned, you're having some falls, you're not moving as well, maybe it's time to go back to see a skilled, trained professional OT-PT speech, get back to where you need to go in the community. So this way you have this continuum of exercise so you can maintain your function throughout your whole life. And so you're not just declining throughout the disease. All right, so how do these power moves help change the brain? So as we go through the exercises and we prepare, we're warming up your muscles, we're moving bigger. So that's one of the big premises behind the research. With Parkinson's, you want to move bigger and faster because your movements get small and slow. So if nothing else out of this presentation, just remember your goal is to move big and move faster. Don't move faster, but then lose your bigness. So always move big first. It helps with coordination. And then it helps with automaticity, making things a little bit more automatic, because with Parkinson's, that automatic piece starts to decline. So as you get up from a chair, it's not as automatic as it used to be. Maybe you have to think about it a little bit more, but through a lot of repetition, exercise, PT/OT, that can become more automatic. All right. So what are the basic moves, which I hope all of you are familiar with? The power moves are power up, and my arrows here, power rock, power twist, and power step. So what do these moves do? How do they specifically target motor symptoms of Parkinson's? So the power up helps with posture. So you're sitting up taller. Anytime we say power up, think sit up tall. So I hope everyone's sitting up tall in their chair right now. As I said, power up, no sleeping. All right, yeah, wake up everybody, right? Power rock, when we rock, we're weight shifting, and weight shifting is essential to movement. If we want to move, we have to shift our weight. Okay, the twist helps with trunk rotation. This we call axial mobility, being able to turn. So again, with Parkinson's, if you have a lot of rigidity in your trunk, we want to work on the flexibility and the rotation around your trunk. And we call that the twist. And the last one is the step. So when we do the step, we're helping with transitioning to move. If I'm here in the chair and I stand up, I have to take a step to move to my bedroom or whatever. So transition. So those are the skills that are targeted with the power moves. And this is research-based. So that's what's nice about it. It's evidence and research-based to directly impact those functional movements that are impaired. All right. So as you're in OT, PT, or any type of community-based exercise class, what you do matters. So I always say, like, if you're gonna take that effort to get up and exercise, then make it like matter, like make it important, right? So what you do matters. So a progressive aerobic. So if you're gonna go get on a bike and you're gonna use the bike for 20 minutes, make it a little bit challenging so that you're really pushing yourself. Strengthening. So you're strengthening the muscles that need to be strengthened. So we talk about Parkinson's. What we really want to focus on is strengthening your extensor muscles, the muscles that help pull you upright, the muscles in your upper back, anything that helps you stand up straight. We're going to really strengthen those muscles. And then stretching, we want to focus on stretching your flexor muscles. So flexor muscles tend to be in the front of your body, and they'll pull you down like this into a stoop posture. So we want to work on stretching all of the muscles that are called the flexors to prevent the stoop posture and keep you upright with good posture. Balance training, working on those balance skills that we find during the evaluation that maybe are not as good as they once were. So are your reactions not as quick, as sharp? Do you have falls because you're not stepping appropriately? So going to see OTPT, they can kind of tune in and really figure out what you need for your balance, because everyone's balance is different. So you may need to be, someone may need to be working on stepping reactions where another person doesn't need that. They need to be working more on like anticipatory reactions. So that makes a big difference. So it's really important to get that evaluation, and so you know where your limitation is, and then we can work on that. And then, of course, this is highlighted skill acquisition. And all this means is if you want to get better at a skill, you have to practice that skill, right? So if you want to get better at walking, you need to practice walking. If you want to get better at transfers, we need to practice sit to stand. We need to practice transfers from a lot of different surfaces. If you have a hard time getting out of your couch, let's practice getting up and down from your couch. So, and we try to simulate that as much as possible in the clinic. It can be a bit challenging, but we do our best. Okay, so how you practice matters. I touched on this a little bit earlier about the intensity, and it's got to be a little bit difficult, a little bit challenging to make change in your brain. So when we talk about sit to stand, we want to do a lot of repetition of that correct movement so that you get that motor memory, that neural circuitry is ingrained in the brain. So as you do it more and more and more, you practice it with that correct movement. Intensity, push yourself as much as you can. That's going to make the change. Telling your brain to be like, wait a minute, I gotta do something different. This isn't working. I gotta change it up. And that's gonna make those cells in your brain change and fire and make new neuron connections. A little bit, I mentioned some complexity involved. And again, it has to be specific to that task. You have to use it or lose it. We've heard that before, right? But if you use it, you can improve it. So the more you get up and walk, the more you practice rolling over in bed or doing your sit to stand, it's going to get better. It's not easy. I'll tell you that. It's not going to be easy, but it's doable, and you can get better. We've seen it in the clinic. We've seen people get significantly better just from a lot of practice and sticking to it, a lot of repetition. And then there's a whole nother aspect that it's probably we don't have time to go into about the emotional engagement part. So when you're exercising, it can be really challenging to exercise on your own, right? How many of us have the diligence to get up every morning and exercise on our own? Like, I don't even have that. So trying to be involved in some type of community class or an online program like the Michigan Parkinson's Foundation offers, because you get that emotional connection. And then it's like, oh, so-and-so, I may see so-and-so there today, so I'm going to log on. And it's another way to keep you engaged, keep you moving, and functional for a long time. I know it's really challenging during these COVID times. And a lot of people are missing that emotional engagement. So all I can say is just do the best you can. Try to log on to some of the exercise classes that are offered through the Michigan Parkinson's Foundation. I just put this up here because I like the slide. It has pretty colors. So we talk about how you practice is important. So attention to what you're doing. So up here on the left, attentional focus, staying engaged. So when I think about this, I think about my younger son. He's like elementary age. Like when he's in lacrosse practice, and my husband's the coach, and they're running all over the place, and he's getting mad because no one is doing what he's supposed to be doing. I'm like, yeah, because they're not paying attention. They're bored out of their mind. You have to get their attention first. So I think the same thing is true here. Like you don't know what you have to do. You have to get your attention and be engaged to get that brain change. Emotional engagement, it's fun. Like, again, like when you're exercising, if it's not fun, it's not going to be something you want to do. So finding something hopefully that you can enjoy so you stick to it. And also there's a little bit of physical effort involved. So you're pushing yourself a little bit more than what you normally would. And then there's a cognitive challenge. Maybe it's unpredictable. I know in my classes, we do some dual tasking, different exercises just to change it up so it's not the same thing all the time. So with all these involved, you have your attentional focus, your emotional engagement, you have your physical effort, and you have your cognitive challenge, and that's all going to optimize brain change. Getting back to that point, we want your brain to change, that neuroprotective effect that's going to happen. All right, so here's another view of what exercise can do for your brain, right? So there's a lot of different things we talked about over here on the left, these neurotransmitters. There's these the neurotransmitter is the dopamine. The nerves release the dopamine. So the exercise helps the receptors, the neurotransmitters, the synapses. It helps that area. It helps the actual cells in the brain with trophic factors and improved metabolism. And then it helps the whole, what we call circuitry of the brain. So imagine your brain and all these connections are going all over the place. It helps the whole circuitry so that the outcome then is improved. There's better automaticity, better executive function, better cognition. And this is all, again, this is all based on research. So I'm not making it up, you guys. So there is a reason why we exercise, a reason why we exercise intensely. And there's a reason why we do the power moves, because it is exercise based and it does specifically target those motor symptoms of Parkinson's disease. So, oops, I'm going to go back. So our big takeaway, I think, here is definitely if you have not had a evaluation from an OT or a PT, I would highly recommend finding one in your area. And maybe you just need a couple visits to get a baseline assessment, but definitely do that if you can, and we will help you find therapists in your area, hopefully. And then the other thing I think is trying to find a group or a program that you can stick to, right? Which again can be challenging. So please, we can try to help you with that as well. And then think about this: if it's not challenging, then it's not changing. So if you're in an exercise program, you don't want it to be too hard, but if it's too easy, it's probably not making a big change. So it's okay if you feel like this is kind of hard, that's a good thing. I would like to end it with that. Definitely a good thing if it's challenging. Okay. Here are some resources. And I don't know if, I think a lot of you probably have some of these, but I will say a good resource is the American Occupational Therapy Association, as well as the American Physical Therapy Association, because that's another way for you to find a PT and an OT in your area. And then I think the other thing would be to contact the Michigan Parkinson's Foundation. And then Alice and I could probably help you as well.
Yeah, absolutely.
And then I think, yeah, that's it. So we wanted to really open it up for questions at this point. I talk really fast. I realized that as I was going, I was like,
And just building off of what Angee was saying too, whether you're in OT or PT or speech therapy, or you're doing virtual power classes, or when things do open up, if you are able to go to a community-based exercise class in person, just the amount of effort you put in matters so much. So don't just go through the motions of the exercises. Definitely try to give your max effort. You'll get more out of it that way. So whatever you're going through, whether it be individualized therapy or a community-based exercise class, definitely be attentive to how much effort you're putting in. The more effort, the better. We all tend to go through the motions. I tend to do that with my exercise classes I take too. So that amount of effort really, really does matter.
yeah, good point. It definitely makes a difference. So I think, I don't know if you can unmute people, Mary Sue, if they have questions. How are you guys doing that?
Hey, Angie, it's Kelly. Yeah, Mary Sue's on the phone. I went ahead and requested everyone to unmute themselves.
Okay.
Okay.
All right. So what we can do is everyone can unmute themselves. And then if you have questions, just raise your hand up and we can try to answer them, and I'll scan through. Is anybody's hand up? And if you have questions about anything else in general.
Mark, do you have a question? I see your hand going up.
Yeah, I don't know how long it's been since I've had baseline check, but is that going to be something that's going to be necessary?
I would definitely yes, I don't know, I wouldn't say necessary, but I think it's a good idea, especially, now, because a lot of people haven't done much since COVID. So it'd be a good idea to, as long as you feel comfortable getting into a facility and doing a baseline check. I will say, Alice and I, in the clinic we work at, it's really clean. We wear masks. We're really safe. We do social distancing. We haven't had any episodes of anybody getting sick in our clinic. I mean, that's just our clinic, but you could,
me right there.
you could call the clinics and, and see what their protocols are if you're concerned about that, for sure.
Angie, do we still follow 6
I'm not
months?
as active as I was because of the COVID. I'm not going to the gym.
Yeah, you're not going to the gym, right, Mark?
Yeah.
No. So even if you
Linda
wanted,
won't let me.
yeah. And I understand that completely. So even if you wanted to get just come in for an assessment, I think that's a good idea, just to make sure you're still, on the right track.
Mark, some people do tune-ups with
How
OT.
many do you have in the?
Go.
How many do you have in the boxing?
How many do we have in the boxing class? Oh, maybe 8. Yeah.
Okay, so it's limited.
It's limited. Oh, yeah, it's limited. Yeah.
Well, because of the new baby coming, we're keeping a low profile.
Right. Understandable. I was going to mention too, if any of you, after listening to us, are interested in getting an OT and PT evaluation, one of the things you could do is I would definitely call the clinics that and ask if there's a OT and PT that are neuro specialists. Maybe they don't have a Parkinson's disease specialist, but even if they have a therapist that's specialized in neurology, that would be good too, because they'd be more familiar with how to treat Parkinson's disease.
Yeah, and it's always nice to ask if they're power certified or LSVT big certified. If you can find an OT or a PT who's certified in those treatment approaches, that's always, I think, the best way to go.
Yeah. I'm going to scan down to see if anybody else is raising their hand up, if anybody else has questions. Some people don't have their video
Oh
on.
yeah, some people are calling in.
Okay. So yeah, go ahead. If you have a question, you can just shout it out.
Or type it in the chat if you don't know how to unmute yourself.
Oh,
And
that's a good idea, Kelly.
if you want to type it in the chat, I can read it off for you.
Okay, that's a great idea.
Do you have any idea when the in-person exercise classes will start again?
And what facility were you going to?
The West Bloomfield Hospital.
Oh yeah, I don't, unfortunately. I think the hospital systems are being a little bit more, I don't know, I guess I'll say strict with their guidelines.
Mm.
So I haven't heard anything, unfortunately. But you know what I'll do is I can call Henry Ford. I'll call them. Their
Okay, thank you.
clinic and ask that.
Thank you.
You're welcome. Okay. Is there anybody on the call that doesn't live like in the Metro Detroit area, like maybe lives in the more rural areas and they don't have like close access to maybe a clinic anywhere?
I am one of those.
Is that Beth talking?
Yes.
Yeah. Where do you live, Beth?
Hillman is between Gaylord and Alpena. Alpena has physical
Oh.
therapy. Gaylord does too.
Yeah. How far is Alpena from you?
A little over, about 30 miles.
Okay. So it's a bit of a drive then.
Yes.
Mhm.
Yeah. And the reason I ask is because there are some online programs that are also available too. It's not quite the same, but you know, being able to get a trainer online who specializes in Parkinson's, they're out there as well. I know I can, if you're interested, Beth. I mean, there's so many, the difficult thing is there's so many options available now. It's really can be challenging to find one that really suits your needs. I'll say that.
Mhm.
I did have some physical therapy with my neck, and the young man, I think there's two of them from that
Mhm.
that place that have worked with Parkinson's people, but he's also done exercises at the Alpena Senior Center, but that's not available now either.
Oh, right.
Oh, okay.
Yeah, I think there are some therapists in Alpena who are power certified because,
Yes.
yeah, so that's good. There's more out there. There's definitely more than there used to be, that's for sure.
When I first was diagnosed, my daughter was living in Indiana, and she got me some printouts of the big, and Alpena didn't have it at that time, but they do now.
Oh, good. Yeah. So that's good. But even if, like, say some of you live a ways, even if you could get like a couple visits, do initial assessment and one treatment just to get a baseline and then get some exercise going, that would be a good start. I mean, you wouldn't necessarily have to like go 3 times a week for 6 weeks, but if you just went a couple times just to get started, I think that would be a good idea too.
Right. And for those of you that are still uncomfortable going to PT or OT in person, some clinics are still offering a telehealth visit where it would be similar to Zoom, where your therapist could guide you through an individualized exercise program virtually. So you still wouldn't have to leave your home or worry about transportation, even like Beth was saying, if you are far right now and just don't want to, and with winter coming,
Oh, good idea, Allison.
want to, make that trip. A lot of clinics are still doing telehealth. I know it's challenging for neuro to do telehealth. It's always better, I feel like, in person, but that's always an option. I feel like that would be better to do than deciding to do nothing.
Yeah, that's a good idea too. Yeah.
I have
So
been,
does more activity help with endurance?
Yes. Yep. The more you do throughout your day, you're building up your endurance to those everyday life activities. So if you're always, sitting on the couch, you're not going to have a lot of time,
Right.
even just everyday life, right? Like getting dressed and taking a shower and putting on your shoes or making dinner, like that'll just wear you out. So the more you do throughout the day, movement is medicine. So the more you move, the better. It'll just keep your body strong overall, help to prevent falls, and just again help to prevent that disease progression, right? That movement is medicine. So the more you do, the better.
Because if I'm raking leaves, then I'm only good for about an hour or so, and then I get tired.
Yeah, so it's good to take breaks. So you can take mini breaks here and there, but don't stop. So it's a fine line, right? Of not like using up your whole energy tank throughout the day, kind of spreading it out, and just taking those mini breaks and then going back to it.
Okay, that's good.
It looks like Kim's Galaxy has their hand up. I don't know if they know how to unmute themselves so they can ask their question.
Okay.
Kim's Galaxy, I sent a few messages, but I don't know if they can see the chat.
Okay.
They have their hand up. I'm not sure if it's on purpose or not.
Oh.
You can also press the space bar if you want to talk. You can press on your space bar and you don't have to unmute yourself.
Oh, okay.
Kim, if you can hear us, press your space bar. That'll unmute you. Yeah, not sure.
It unmutes only for the time that you're holding the space bar down.
Okay, yeah, if you can press and hold your space bar.
Oh, yeah.
Try and do that. Okay, they put their hand down, so maybe they don't have a question.
All right.
Okay.
Allison had a good point though. When we talk about exercise, I like Mark said, raking, I would consider that exercise. If you're outside raking for an hour, that's exercise. So don't discount that at all.
For an hour.
If you're doing laundry and you have to walk up and down stairs, that's exercise. So, definitely keep that in mind too. I think another good thing to do if you're able to is to get some type of, I guess like a Fitbit or a watch that can count your steps. So you keep track of how much you're moving throughout the day. And I think they're pretty reasonable. You can find some on Amazon, but at least it would give you an idea of, well, I've only moved like 500 steps. I think I need to get up and move. Even if it's just moving in your house, going up and down stairs. I've recommended that quite a bit to several of our patients to just try to help keep track of your movement a little bit more.
Yeah, that's a great idea. I know some of them, some of those Fitbit trackers or step counters will also tell you when you've been sitting for too long, which is a blessing and a curse, right? But if you've been sitting for too long, it'll just send you just a notification to stand up. So it can help you aware too of if we're sitting for too long, need a movement break. So that will just prevent stiffness as your day goes on too.
Yeah.
Don typed a question in the chat. It says, is there an exercise specific to dystonia, which I have with my PD?
Yeah. So I think, again, that would be like when you did the physical therapy evaluation, they could evaluate like where is your dystonia? Typically, I see it in like ankles, but it can be anywhere really. Dystonia can be challenging to treat. I'll let Allison chime in if she wants to as well.
Yeah.
So usually in physical therapy, the first thing I like to ask them is about their medication. Sometimes dystonia can be helped with the medication adjustment. That's the first thing. And then the other thing we do a lot of is we do a lot of stretches, just a lot of stretches of what the joint, maybe some mobilizations of the joint to keep it flexible.
You're there.
So I usually start with that. but it's definitely like, it's challenging. Yeah, for sure. But it's one of those symptoms you have to definitely keep on top of, like stretching every day.
So
Do you have
now
any other suggestions?
we want to talk.
Yeah, and just like Angie was saying, it's something that you'll have to treat every day. So when you do your PT evaluation or your OT evaluation, those therapists will give you a specific
I would
set
go
of
here.
exercises to help. And those therapists may
I
also
said not there.
your dystonia
Okay.
gets worse when you are moving a certain way or when you're doing a certain activity. So maybe some modifications or tips that therapists can give you to kind of prevent that from getting worse while you're doing a certain activity, while you're reaching or whatever it may be. So that therapist will help you to give you the specific stretches and then maybe look at some activity modification just to prevent it from getting worse throughout your day. And it's hard. That's one of the harder symptoms. You're not alone. But yeah, I would go see a PT or an OT and get some specific stretches. And just know too that as time goes on, those stretches might not work forever and you'll have to go back to therapy and get a new set and get some new ideas if the dystonia is changing.
Yeah, good. Thanks, Alex.
Okay, it looks like Kim figured out how to unmute themselves and turn on their camera. Hi, Kim.
Hi.
You can ask your question now.
She's still muted.
Oh, no.
Unmute.
Unmute.
Oh,
There you go. There you
There you
go.
go.
She's my care provider for the last 16 years with DBS, with PD and DBS.
And I'm trying to teach him technology, and it's like, don't touch anything. Once I get it set up, just don't touch anything. So
I have to be
anyway,
able to do this with my doctors next month.
yeah. So now we know that it works. Okay, so ask your question.
My question is, there's a lot of talk about PD, but there isn't much talk about DBS, deep brain stimulation surgery, which I had about 4 years ago. And that worked very, very well. I went into physical therapy after I had that done and basically kicked butt at it. It was fun. And I still feel very good about myself and my abilities and everything. I'd like to do PT again. Should I ask my doctor for prescription?
Yeah, I would definitely go. If it's been a while, definitely go get a prescription and go in then. I don't know if you've done it before, maybe you could go back to where you went and they may have your original outcome measures so that they could compare where you are now to before.
Yeah, because we did that going in when I started and when I ended. She did a comparison of everything.
Yeah.
I came out better at everything.
Good.
They probably do have everything.
Yeah.
Yeah, this is me.
Yeah.
They probably do. And what we've been doing is I've been trying to encourage him with the exercise programs, which are 5 days a week.
Yeah.
And that's what I want to encourage, but it's hard for me to get him to do that. Oh,
Yeah.
Are you guys
go
done?
get a new round of PT and that'll help you to get some new ideas and get a refresher and maintain where you are and hopefully get a little bit more strength. That's always a good thing to get another round of PT and then you can get some new ideas for what to do at home. And sometimes it's nice to just be held accountable too.
Yeah.
I get out and I walk with and I run our dogs. We have 2 Irish Wolfhounds. So I use that as some of my PT, chasing them around.
Yeah.
Yeah. So you mentioned DBS, deep brain stimulation, and it is definitely beneficial for some people. We didn't talk about here today. That wasn't our focus, but I think, like you said, it's definitely beneficial, especially for those people that have really bad tremors. I've seen really good benefits with that. So
It wasn't tremors for me. It was dystonia in my left foot and leg and everything. Became incredibly painful. And the DBS works.
So that gentleman, were you the one that asked? Someone asked about dystonia. That is another treatment option. Is DBS for dystonia as well?
That was somebody else. Yeah.
Okay.
I heard that. I figured I'd throw that in the conversation too.
Yeah, and that's something you should definitely talk with your neurologist about.
Yeah.
Yeah.
All right. Well,
We are doing a program on DBS surgery next Tuesday evening.
Oh, okay.
o'clock.
When,
Support group meetings with Dr. Cullis and Dr. Morales. He's the neurosurgeon.
Okay. I went to U of M to get mine done.
Oh, did you? Did Parik Patel do it?
Yes, he did.
Did he? Well, good. You went to a good place.
Yes, I know. And I remind him of it every time I see him.
Does Dr. Chu do your programming?
Yes, and he's going to be the one I'm going to see next.
That's
next
why
month.
we're trying to figure this out, because our actual laptops don't have the video and the microphone synced. So it's like, okay, we're getting a tablet.
Yeah.
Roger, I see you have your hand up. Roger, do you have?
We'll get off then.
when is that meeting? I didn't get it on DBS.
Hang on, I'll give you the exact time. Wait a minute, wrong one. Bear with me a minute.
I just got my third neurostimulator implanted in August.
Oh, wow.
I've had it since 2016. It's a miracle.
Oh,
Wow, that's great.
I got Medtronic's new cutting edge. It can map your brain signals live.
Wow. So you were awake the whole time they did it?
Yeah.
9.5 hours.
Wow.
Wow.
And you were awake too.
I was awake too.
Oh.
I would
Not
do
trying to be,
it all
one up and
over.
The DBS program is Tuesday, November 17th at 7 p.m.
Okay, thank you very much.
It's going to be the same link that you used today to get onto this program.
Okay,
Same Zoom link, same meeting ID, same password. If you want to just copy and paste that and put it in your calendar, 7 o'clock on Tuesday.
I guess I like more things in Michigan besides the lake.
So Don was asking about dystonia. That may be a good program to log on. Then maybe he could ask Dr. Cullis when they talk about DBS about options for dystonia as well.
yeah.
Yeah.
It has gone from being an 11 of pain to no more than an annoyance when it kicks in, the dystonia.
Oh,
That's
wow.
wonderful.
And it was
That's
years
really
ago.
great outcome.
That's
Yeah.
great news.
And
Are you doing as well today as you did right after you had the surgery? Has the level of improvement stayed the same?
No, it hasn't. It's gone down a bit.
A little bit? Okay.
I'm still very proud of what I'm able to accomplish and do and everything. So
He was able to go back to work for a year and a half, actually,
Hey,
afterwards.
that's wonderful. That's
as an engineer
wonderful.
of food,
Yeah. So, but now we're just dealing with a little bit, not only of the physical differences, which are, whoops, everyone left?
No, you're still there. We see you.
Oh, okay.
because yeah, it was just
Okay.
a little couple white ovals.
But then we're starting to have a little cognitive difficulties.
Yeah.
So,
and executive, and they said that that's kind of typical. So although I went in and had the cognitive test done right before I had the surgery to check me out and make sure I was good for it, I didn't have it. I didn't go back for a recheck until 4 years, and there was not much difference between them. Basically, the curves were about the same for everything, just a little higher or lower.
That's good.
but there's
That's good.
definitely some differences now.
Yeah.
But it you know,
The gait, it's kind of funny to watch me try and get moving. I shuffle my feet real bad.
no, but it was definitely worth it and very good.
Yes.
Good.
Thanks for letting me do the commercial for them.
Well, that's fine. That's fine. You know, other patients need to hear from people like you who've had it.
Yeah.
You know, it doesn't do any good for me or Angie or anyone else to talk about it. You're the one who's had the experience. So
We've
Yeah.
actually
Grateful.
talked to people, and with his first neurologist, Delu, we've actually given talks to the classroom
where he does his teaching. We've
Yep,
been
where he
into
does his
thing.
teaching and things. We have been very much out there for people.
Oh, great.
That's great.
I tell people in the grocery store, see, you know, I can tell what it's like to have Parkinson's. I'll walk up to him and say, can I ask you a question? Do you have PD? If so, have you tried the DBS or anything like that? So,
Yep.
Good stuff. Very good stuff.
That's great.
Yeah, that's very encouraging. That's awesome.
Yeah.
Well, so thank you for the patience with us trying to figure out this tablet.
Yeah.
So we could do that.
No problem.
Did you
Okay.
see
All right.
this? Did you see the comment here, Angie,
Oh, yes, I liked.
in the chat?
Question from Beth.
Spot on that.
I like to ride my bike and usually did it in the evening. The other day I went at 3:30 in the afternoon and it was extremely difficult. Is that normal?
Well, I guess the first question is, look at when your medication is on, or like, when did you take your medication last?
Right.
And
Yeah, because we have a bike that we brought in the house and we always time it to his meds, on or off.
So see, like, try to go, if you're going to go outside for a bike ride, try to go when you have when your medication is ideally optimized, when it's on, and see if that makes a difference. And it's pretty common though, like to have, people will say they have a good time of day or a bad time of day. So that's not that unusual. But if your medication was on and that time still wasn't good, then I would just try a different time. Maybe, and it also depends on, like, how did you sleep that night before? What was your eating patterns? There's a lot of different things that can go into it. I think one of the things I learned from everyone in the community after doing this for so long is you can do everything the same and it'd be really good. And the next day do everything the same and have a total different day as far as symptoms go. And I think that's what's frustrating from what I understand is I did everything the same. Why do I not feel the same? So, and you guys could probably answer that question better as far as,
There are good days and bad days.
Yeah.
Yeah, you may just have had an off day. Another thing to keep in mind too is we just had the time change. So you may have 3 o'clock before, now it may be 4 o'clock with that time change, depending on if you are in Michigan. But that could have made a big difference, even though it's just been an hour. That could play a role into, again, like Jim was saying, when is your medication on? So that hour difference may be into everything. So just go through your medicine and see again, like, when your on period is. And again, don't be too discouraged. It may just have been an off day.
Right.
Thank you. I did take the medication that day about 3, so maybe it hadn't kicked in good enough at that point.
Right. Yeah, that's true.
Can I make another pitch for the DBS? I lost my train of thought. That happens a lot. Yeah, it reduced my medications to about a third of what they were.
Oh, that's great.
For the DBS.
Wow.
Yeah, they just went in and said, we take away that pill, I used to take like 28, 29. Now I take like 8.
That's great.
But the other thing we wanted to say too was that if we do something social, for example, going to the farmer's market and doing a lot of errands and things like that, I know the next day he's going to be tired. And he was involved with a gaming group where they would have conventions before COVID. And I could always tell the next day he's going to sleep a lot. So for the person who was saying that her bike riding was a little bit off, what did you do the day before? Did you work outside? Did you do a bunch of stuff trying to get things ready for the fall?
I don't remember.
Okay. Well, it does make a effect, that type of thing.
Yeah.
So, and I'm aware of it because I know I get tired. So,
Right.
as you know, as the holidays come too, that's another thing. And so you just have to, kind of compartmentalize it and think about what you can do and what you did the day before you get stressed out.
Good advice.
Okay.
Yeah,
We've
that's good
taken up
advice.
enough of everybody's time.
You're good.
How do I get back out of this? So I'm not showing on the screen or the microphone or anything.
One thing about PD is that we learn how to adapt. If we can't do it
That's
one
so
way, we're going to
true.
do it another way.
Yes.
That's right.
Sometimes, most of my jeans now have holes in the knees. I'm just having to go down on my hands and knees and crawl instead of trying to walk.
I've heard a lot of people say that to me. If they have a hard time, they'll get down on their hands and knees and crawl to where they want to get.
Wow.
Yeah.
When you have to get down on your knees and crawl to get to where you want to be, that's the time you go to the doctor. And see what can we do.
Yes.
He
Or
has
physical therapy.
physical therapy.
Yeah. Okay, folks, we're going to have to sign off. We've got another program scheduled. I want to thank you all for joining us. I want to thank Allison and Angie for their great presentation. I think we had some
Very
really
nice.
We had some very good questions. I do want to remind you that at 6 o'clock tonight, we're doing power moves. We have our regular exercise class Monday through Saturday at 10 a.m. And we also have it on Monday and Thursday evening. So we've got class tonight at 6. If you don't already have that link, just go to our website. I'm going to type it in the chat so everybody can see it.
Thank you, Allison and Angie.
Thank you for having us.
Thank you.
Thank you.
All right. Have a good afternoon. Enjoy the weekend. It's supposed to be nice.
Yes, enjoy the warm weather.
We will.
Hey, everyone. Bye.
Bye. I'm going to end the meeting.
Okay. Bye.
Bye, Angie.
Bye,
Bye,
Mark.
Allison.
Bye, you guys. Good to see everybody.
Have a good weekend.